Hi, and welcome to It's Time for Insurance to offer broader access to acupuncture care with Samantha Blair. So, today's agenda, we will be covering the introduction of topics, the power of acupuncture, current insurance coverage, why it is necessary to broaden this coverage, and some final takeaways. So, acupuncture is a powerful Eastern medicine technique using hair-thin needles to stimulate points across the body to promote healing and balance across different channels and meridians in the body that can correlate to certain disorders, diseases, and aches and pains. Acupuncture has been used for thousands of years to alleviate said discomforts, and using acupuncture can be a far less invasive way of treating the source of the problem, as well as achieving beneficial results such as pain relief, allergy relief, anxiety and depression reducing, and things of that nature, as well as being incredibly cost effective, which helps people maintain a lower level of stress because they're not worried about how they're also going to pay for it. So acupuncture is really beneficial in regaining your ability to live your life normally again. So for some people that's going back to running their marathons, other people that's walking the dog on a daily, for some people that's being able to pick up their purse again, basic things like that. So it's really nice to be able to regain your life through acupuncture. So current coverage with acupuncture within insurance companies is about 12 visits a year with most insurance companies. This is going to vary from plan to plan. However, the ones that I was able to find that say that they have acupuncture coverage include Aetna, Blue Cross Blue Shield, Banner Health, United Healthcare, Kaiser Permanente, which to my knowledge only accepts acupuncturists within their facilities because that's how their insurance works, Cigna, and then HealthNet, just to name a few of the companies that I was able to find. And then through work experience, I'm aware that the VA and Medicare and Medicaid also cover acupuncture treatments, again with a limited range of things that they can treat. So for example, most insurance companies will cover neck and back pain, nausea, addiction, depression, insomnia, dental pain, tennis elbow, osteoarthritis, menstrual cramps, respiratory disorders, stress, anxiety, fibromyalgia, Parkinson's disease, and post-stroke care. Unfortunately, with the 12 visits a year, that generally means for patients 1 visit per month, which, depending on what you are working on and the severity of it, just might not be enough, because acupuncture is cumulative, meaning that you need to build your system back up before you're able to space visits out that far, which is why it's important for insurance companies to acknowledge not only acupuncture's benefits, but how it could be medically necessary to have just a few more visits within the year. So why is more coverage necessary? Many acupuncturists do not bill insurance companies directly, meaning they are not in network with insurance companies. Because it is so time-consuming, it is difficult to do, and accepting insurance means that they may not get paid out for a longer amount of time, as opposed to taking payment up front and sending out what is called an insurance receipt or a super bill, which is the receipt with all of the ICD codes, which is the medical codes that the insurance uses to know what was done during the treatment, as well as having the provider's license number and NPI number. By not accepting insurance and by insurance companies not covering as much, it makes it more difficult for patients to seek acupuncture care because they have to work harder to get their money back. So rather than just handing over their insurance card to, let's say, the receptionist or whoever runs the billing department in that acupuncture clinic, they're having to ask for that receipt, wait for it to be made, have it emailed to them or printed, and then mailing or emailing that to their insurance company and waiting on a response, which further discourages patients from seeking acupuncture as a form of treatment for whatever ailment that they're seeking help for. Acupuncture is more cost effective for a wide range of conditions, so saving money for both patients and insurance companies isn't everyone's benefit. So, for example, as opposed to a patient seeking acne coverage because they're dealing with moderate breakouts, instead of going to a primary care doctor, getting a referral to a dermatologist, that's now 2 visits with no treatment provided, as opposed to going to an acupuncturist, who, I'm not saying that there's no use for a dermatologist or a primary care doctor, however, it could have been lightly addressed and sometimes even fixed through acupuncture if it was just something that needed moderate attention, so maybe doing some red light therapy or using certain points to realize where there's certain imbalances, as opposed to paying for 2 separate visits on top of a prescription, going out to get it, trying it out, and having possible adverse effects to said medications. So, for example, I know for acne, there could be pills that are taken as well as topicals, where pharmaceutical topicals, as opposed to an acupuncture where you could be treated with simple acupuncture points with the needles, using red light therapy, and possibly some herbs if they're needed, but sometimes they aren't. Another benefit to acupuncture is that there are no referrals needed. Most acupuncture clinics are able to take patients without needing a primary care physician's referral to go see it for said conditions. And then current acupuncture coverage is a little too limited to see benefits. It's not that acupuncture isn't beneficial, you just need to go in a few more times, depending on how severe the problem that you're treating is, as well as just how long it's been going on for. You can't fix everything with a single needle, and sometimes patients are a little reluctant to come in more often because that can mean that it's coming out of their pocket or it's coming out of those 12 visits. So it's really putting a lot of strain on the patient, again, by insurance companies not covering these acupuncture appointments as medically necessary. So our final takeaways are: acupuncture treats more than what insurance companies currently cover. Acupuncture is safe and cost-effective for both insurers and insured individuals. Eastern and Western medicine both have their benefits. Use them to your advantage. And insurance companies should consider broadening coverage for acupuncture. And a final point that I would like to show here. So here is one of my former coworkers, a licensed acupuncturist, and she has a friend that is an anesthesiologist, and she asked for a needle of theirs, and this orange part here is the tube for an anesthesia needle, and on top here there's about 10 acupuncture needles within that, and that was just us smiling, showing how hair thin that these needles are, because that end is not how thin the needle itself is. That's just a guide for the acupuncturist to still continue holding onto the needle like safely and like have a better grip on it. So I just thought that was a really fun addition to this. And then here we have my work cited, which is where I got the information as to which companies had acupuncture coverage and what they have shown to cover. Thank you so much. If you have any further questions, please give me a call or text. Have a great day. Bye-bye.